Beetroot is interesting because the active story is not really the color or the word superfood. It is dietary nitrate. In the right chain of events, nitrate can become nitrite and then support nitric oxide signaling, which helps blood vessels relax. That gives beetroot a plausible reason to affect exercise efficiency and blood pressure. But plausible is not the same as guaranteed, and the evidence looks strongest in specific use cases, not as a universal energy drink.
So if someone sees a beetroot powder ad promising bigger pumps, better cardio, and healthier blood pressure, what part should they believe first? Is this mainly a gym supplement, a heart health food, or just one of those things that measures well in saliva but does not change much in real life?
I would split it into three buckets. First, exercise. Meta-analyses and reviews find small improvements in some aerobic and high-intensity outcomes, but individual trials still show misses. Second, blood pressure. Beetroot juice can lower blood pressure modestly in some studies, but it is not hypertension treatment. Third, the pump feeling is not the same as proven performance. A better blood flow mechanism can exist without every workout becoming stronger or faster. Here is the weirdly practical part. Your mouth participates. After you swallow nitrate, some circulates back into saliva. Oral bacteria help reduce nitrate to nitrite, and nitrite can then contribute to nitric oxide, especially in lower oxygen or acidic conditions. That means two people can drink the same beet shot and get different biology. It also means aggressive antibacterial mouthwash around dosing can plausibly blunt the pathway.
That is more fragile than the label makes it sound. If the bottle says 6 or 8 millimoles of nitrate, people assume the dose is the dose. But you are saying the product amount, the bacteria in the mouth, and maybe timing before exercise, all sit between the label and the actual effect.
Exactly. Trials often use concentrated shots in the range of roughly 6 to 13 millimoles of nitrate, commonly taken about 2 to 3 hours before testing, though protocols vary. A powder, gummy, shot, and whole beet salad are not automatically equivalent. If someone wants to test it for training, they should use a product that clearly states nitrate content, repeat the same timing, and compare similar workouts instead of trusting one great day.
Where would you expect it to show up first? A runner trying to hold pace, a cyclist doing a time trial, a sprinter trying to hit top speed, or someone lifting? Because the internet tends to flatten all of those into performance. And I want the missed cases included, because they are useful. If trained sprinters drink beetroot and their saliva nitrate jumps, but their 60 and 100 meter times do not improve, that tells viewers not to confuse a biomarker response with a medal-winning response.
The more promising zone is usually endurance, exercise efficiency, repeated high-intensity work, or recovery of physiological cost. A 2026 meta-analysis found significant but modest improvements in VO2 max, high-intensity interval sprint performance, and mean power output. But there are counterexamples. Trained cyclists in a 3-minute all-out test did not improve with nitrate, caffeine, or the combination. So the honest phrase is potential edge, not reliable upgrade. Training status matters too. In judo athletes, beetroot juice did not increase total throws, but it improved recovery-related markers like 1-minute heart rate and tissue oxygenation, with larger effects in recreational athletes than elite athletes. That fits a pattern. The more optimized the athlete, the smaller the room for a supplement to show up. Beginners should still not mistake that for replacing training, sleep, carbohydrate, or pacing.
Let's switch to blood pressure, because that is where casual advice can get risky. If someone has high readings and starts drinking beetroot juice every morning, what is the line between a reasonable food experiment and delaying real hypertension care?
The mechanism is credible. Nitric oxide signaling helps vessels relax, which can reduce vascular resistance. Systematic review evidence suggests beetroot nitrate can lower blood pressure, especially in some hypertensive contexts, but the effect is usually modest and variable. That means it may be an adjunct food strategy, not a medication replacement. If readings are repeatedly high, the useful move is home monitoring plus clinician care. not adding a red drink and hoping.
Who should not freelance with concentrated beetroot nitrate? I am thinking of people already using blood pressure medication, nitrate drugs for chest pain, erectile dysfunction medication, or anyone with complicated cardiovascular care, where extra vessel relaxation might not be harmless.
That is the right caution list. The issue is not that beets are poisonous. It is that concentrated nitrate products may push the same physiological direction as certain medications: lower vascular tone and lower pressure. People using prescription nitrates, multiple blood pressure drugs, erectile dysfunction drugs, or managing heart disease should ask their clinician before using beetroot shots as a routine supplement. Food portions are different from high-dose concentrates, but the context still matters. Another practical distinction is food versus supplement. Whole beets and leafy vegetables bring nitrate inside a food matrix with fiber, polyphenols, potassium, and normal meal patterns. A shot or powder is a delivery system designed to concentrate nitrate. Neither is automatically superior. They answer different questions. For general health, nitrate-rich vegetables make more sense. For a race day experiment, a standardized shot is easier to test because the dose and timing are controlled.
Give me a clean decision rule. If someone is healthy, not on interacting medications, and wants to know whether beetroot helps them, what should they measure before they decide it is worth the money and the red-stained sink?
Pick one outcome that matters. Pace at a set heart rate, power during intervals, recovery heart rate, or home blood pressure averages if that is the goal. Keep dose, timing, meals, caffeine, and mouthwash habits consistent. Try it in training, not first on race day. Stop overselling it if the numbers do not move. And remember the harmless-looking quirks. Beetroot can turn urine or stool red, and people with certain kidney stone histories should be cautious because beetroot can be oxalate relevant.